Hello, everybody. My name is Michael Fulton. Phlebotomy has been around since the early Greek and Roman times. There has been a dramatic change over the past several centuries. Phlebotomy started back in the early Greek and Roman times. Back during that time, phlebotomy was performed to get rid of demons and diseases from people. This was done with a lancet and was called bloodletting. Bloodletting is when blood is drained from a person. Several years later, Pope Alexander III made it where bloodletting was not allowed just by anybody. So barbers decided that they would continue doing bloodletting. To many of the people, this made more sense because the barbers had more experience with sharp objects. Have you ever seen the barber pole outside of your local barber shop? The red on that barber pole represents where people could get their bloodletting done. The white stripe represents the bandages. Throughout the years, not only was people using lancets to perform bloodletting, but also leeches. When people would have bloodletting done, it was a very dangerous procedure. People would die from losing excessive amounts of blood. During the 18th century, people finally began to limit how much blood a person could lose before they would stop bleeding. With a patient, they'd stop right before they passed out. Today, bloodletting is not performed except for extreme rare diseases. Today, we use what is called phlebotomy, which is a distant relative of bloodletting. In the process of phlebotomy, small amounts of blood is taken from the body to run tests on patients to check on their health. This is also performed in a very clean environment. Phlebotomy is done in hospitals, clinics, doctor's offices, outpatient labs, several different places. And it is not used with a lancet unless it's with a finger stick. It is done with a needle. It is a very safe procedure now, very clean. People don't usually die because of having this done. Phlebotomy is considered a form of science. To be able to perform phlebotomy, you must be able to pass the phlebotomy course. In my experience, it took 3 months of classroom work to do, and then 3 months to get through clinicals to be able to get my phlebotomy certificate. I've been a phlebotomist for 5 years now. This is a great skill to learn, and over time, you become better. There have been several changes throughout the centuries of phlebotomy, from the name of the technique called bloodletting, using leeches, and now we use a small needle with less blood. Throughout many of the years, things have changed. Thanks to technology, phlebotomy has come a long way and proceeds to move forward with technology. They have this machine that's called a vein finder. I have not used one personally, but I've seen it used before, and it would come in very much in handy with some of my patients that I have. I personally cannot wait to see the changes in the future in the phlebotomy area.